This conference will now be recorded.
Okay, so today we will start a new chapter, CNS depressants. So we know the classification of poisons. We have four types. We have corrosives, irritants, systemic poisons, and miscellaneous poisons. We have finished corrosives and then we have looked into irritants. Now we will see systemic poisons. So systemic poisons are divided into three types. One is CNS poisons, second one is serious poisons, and third one is asphyxiants. CNS poisons, serious poisons, and then asphyxiants. And then CNS poisons are again divided into three types. We have cerebral, spinal, and peripheral nerve poisons. And then the cerebral has again three subclassification. One is CNS stimulants, CNS depressants, and then delirium poisons. So today we are going to look into CNS depressants, and mostly we will look into alcohol. So you know, alcohol, even though it seems to excite a person, it seems to elevate the mood of a person, it is not classified as a CNS stimulant. It is classified in a CNS depressant because even though it excites, in the later part of its effects, it will depress the CNS. So that's why it is classified more in CNS depressant action. So classification wise, systemic poisons are divided into three types: CNS poisons, serious poisons, and asphyxiants. CNS poisons are again divided into three types: cerebral poisons, spinal poisons, and peripheral nerve poisons. And the cerebral poisons are again divided into three types: CNS stimulants, CNS depressants, and then delirium poisons. So, what are inebriant poisons? Inebriant poisons are the poisons which produce intoxication. These are the ones which produce intoxications, just like lightheadedness, confusion, disorientation, and drowsiness. And the most important example of these inebriant poisons is alcohol. There are also other examples also like barbiturates, benzodiazepines, chloral hydrate, anesthetic drugs. All these also will cause inebriation poison. So inebriant poisons are nothing but which produces intoxication like lightheadedness, confusion, disorientation, and drowsiness. Disorientation, drowsiness, lightheadedness, and confusion. And the classical example is alcohol. So alcohols are divided into these three types. What is monohydroxy alcohol, dihydroxy alcohol, and trihydroxy alcohols. Monohydroxy alcohols, we have two types: ethyl alcohol and methyl alcohol. Ethyl alcohol is otherwise known as ethanol. Methyl alcohol is otherwise known as methanol. And then we have dihydroxy alcohols, which is ethylene glycol and then propylene glycol. Ethylene glycol and propylene glycol. And then we have trihydroxy alcohols, which is glycerol, glycerin, and propane. They are not exactly alcohols, but only the derivatives of alcohol. So glycerol, glycerin, and propane. So main thing which we are going to deal with is monohydroxy alcohols, that is ethanol, ethyl alcohol, and then methanol, methyl alcohol. These two has been asked many times in your examinations. So now we will see ethyl alcohol or ethanol. So ethyl alcohol is commonly termed synonymous to ethanol or otherwise grain alcohol. It is also called as grain alcohol. And then the physical appearance, it appears as clear liquid It is a colorless liquid. It has a fruity odor. So alcohol has fruity odor, and then has sweetish burning taste. Sweetish burning taste. It is both water soluble and lipid soluble. So what is the source of alcohol? Ethyl alcohol is produced by fermentation of sugars. So alcohol is produced, ethanol is produced by the fermentation of sugars, mostly cereal, vegetables and fruits, by the fermentation with the yeast. So it is produced by fermentation of sugars by the yeast, and the sugars we get is from cereals, vegetables and fruits. So what are the uses of this alcohol? So it is used in beverages like rum, vodka, whiskey, beer. So all these are beverages, and then alcohol is also used as a solvent for aftershave lotions, and then cologne. Cologne also, it is a type of semi-liquid perfumes, and then also perfumes. So alcohol is used as a solvent in perfumes, and then alcohol is used as in a medicinal purpose. It is used in antihistaminic syrups, and it is also as a surgical spirit, and then ethanol sponging, all these things in medicinal purpose. And then alcohol is also used as an antidote in methyl alcohol poisoning. Ethanol is used as an antidote, and also in ethylene glycol poisoning, ethanol is used as an antidote. And preservative, it is as a preservative for viscera, for chemical analysis. So these are some of the uses of alcohol. It is used as a beverages, as a solvent in medicinal purpose, as an antidote in methyl alcohol poisoning and ethylene glycol poisoning, and then it is used as a preservative. So what is the percentage of alcohol in the various beverages? You can see in vodka we have 60 to 65% of the alcohol in vodka. In rum we have about 50 to 60% of alcohol. In whiskey, in gin and brandy we have 40 to 45% of alcohol. In port and sherry we have 20% of the alcohol, and then in wine and champagne we have 10 to 15% of alcohol, and then in beers we have 4 to 8% of alcohol. So beers are the lowest in alcohol content, and then vodka is the highest in alcohol content in beverages. So in India, the maximum alcohol content allowed is 45.5%. Above this level, selling alcohol is illegal. So these are the values. These are the photographs of all the alcohol brands. You can see all vodkas are Royal Challenge, McDonald's. So I know some of you may be familiar with these terms, and then familiar with also the liquid inside these bottles. So we will see what the other educational material we can learn. What is toxicokinetics? So alcohol is rapidly absorbed from stomach, about 20%, and it is more in large quantities absorbed from small intestine. About 80% of the alcohol is absorbed from small intestine, and only 20% is absorbed from stomach. And then maximum alcohol concentration in the blood can be reached within 30 to 90 minutes. So within it will start within half an hour, and then within 1.5 hours it will reach to the maximum concentration in the blood levels following the last drink. And then more than 90% of the ingested ethanol is metabolized in the body, and only about 5 to 10% is excreted unchanged by the kidneys, lungs and sweats. So this is the reason why people who drink alcohol, they smell a lot. They smell a lot because alcohol is excreted unchanged through the sweat. and it also, because it is unchanged and excreted through the lungs, through the breath. So that's why alcohol, they will stink. The breath is very stinky, and also the body is very stinky, because the alcohol will be excreted via sweat, via lungs, through breath, and also it can be excreted through urine by kidneys. So 90% is metabolized and 10% is excreted. So this is the pathway of alcohol metabolism. We can see here ethanol, which is ethyl alcohol, it is converted into acetaldehyde in the cells. It is converted into acetaldehyde by ADH, acetaldehyde, ADH, alcohol dehydrogenase. So ethanol is converted into acetaldehyde by alcohol dehydrogenase, and then this acetaldehyde is converted into acetate by aldehyde dehydrogenase. One is alcohol dehydrogenase, another is aldehyde dehydrogenase. Ethanol, ethyl alcohol is converted into acetaldehyde by alcohol dehydrogenase, and then acetaldehyde is converted into acetate by aldehyde dehydrogenase in the mitochondria, and then this acetate will enter into the circulation, and it has its effects on the brain and the cardiac systems. So this is the normal metabolism that occurs in the body whenever a person takes alcohol. What happens in acute poisoning, which is nothing but intoxication or inebriation? Intoxication or inebriation. So we will have, there are 7 stages which occurs in alcohol intoxication. You can see BAC means blood alcohol concentration, which is measured in milligrams per 100 ml blood alcohol concentration. And then we have the stage of intoxication and then clinical features. Suppose if the blood alcohol concentration is about 0 to 50 milligrams per 100 ml of blood, then the patient will have sobriety, the stage of sobriety, where the person will not have a much difference. He is near normal behavior. He doesn't have, he just has taken alcohol, but there is nothing peculiar about the behavior of that person. It is called stage of sobriety. And then if the alcohol content increases from 50 to 100, then he will be in a stage of euphoria, where he will feel a sense of well-being. There is increase in self-esteem. The fine movements are affected, like picking up or buttoning or unbuttoning of the clothes will be affected. So the person will be in euphoria, feeling of well-being, feeling that his problems are not there. So euphoric effects. If the blood alcohol concentration is about 50 to 100 milligrams per 100 ml, and then if the blood alcohol concentration is increases from 100 to 150 in the blood, then he will get into the next stage called stage of excitement. Stage of excitement, where there is emotional instability, the increased confidence levels will be there, lack of self-control, and increased reaction time. So this is the time where the bikers or the drivers of the car will be affected, because the reaction time is increased. Normally, a normal person, whenever he comes across while traveling in a car, if he comes across any obstacle, he will immediately press the brake button or brake pedal. But if he takes alcohol, the reaction time to put the leg on the brake pedal will be very delayed. It will be increased. So that's why most of the accidents will be taken away because of the increase of reaction time. So it occurs if the alcohol content in the blood is about 100 to 150, stage of excitement. And then if the alcohol content is about 150 to 200, then he will land in a stage of confusion, where the person will be disoriented, confused. He will have reeling, lightheadedness, vertigo, diplopia will be there, Now one person will appear like two, and then there will be slurred speech. So slurred speech will occur if the blood alcohol concentration is about 150 to 200, and then there is staggering gait. Staggering gait, the gait will be staggering, slurred speech, disorientation, confused, and then vertigo and diplopia. Stage of confusion. So there are four stages in this: stage of sobriety, stage of euphoria, stage of excitement, stage of confusion. And we will see now to the next. And then we have stage of stupor. If the blood alcohol concentration is about 200 to 300 milligrams per 100 ml. In this, the person will have diminished responsibility. Response means when we talk or when we pinch, so he will not have much response to that. So he will have inability to walk, vomiting can occur. So this is stage of stupor where the blood alcohol concentration about 200 to 300. And next is stage of coma. If the blood alcohol concentration is about 300 to 500, the person will land in stage of coma where he will be unconscious, his temperature will be subnormal, he will have incontinence of urine, and then there is respiratory compromise. And then if the alcohol concentration in the blood is greater than 500 milligrams per 100 ml, then death will occur. Death is due to respiratory failure. So death can occur if the alcohol concentration is greater than 500 milligrams per 100 ml. So these are the 7 stages of alcohol intoxication. One is stage of sobriety, and stage of euphoria, stage of excitement, stage of confusion, stage of stupor, stage of coma, and stage of death. So one feature in each is you can easily remember from 0 to 50, 50 to 100, 100 to 150. So you can add 50 to every stage. If you can remember the first stage 0 to 50, then you can add every 50, 50 to 100, 100 to 150, 150 to 100, 200 to 300, 300. So very easy to remember. And then sobriety, we know that it is a normal behavior. Euphoria, it is a sense of well-being, self-esteem will be increased. Excitation, he will lose control, he will be emotionally, his confidence levels will increase, and his reaction time will be increased. Very important. Confusion, the slurred speech and staggering gait. Stage of stupor, the patient will be unable to walk and he can have diminished responsibility and walking. And then stage of coma, the person will have incontinence of urine, there can be temperature decrease, he will be unconscious, and then stage of death is due to respiratory failure. So how alcohol attacks the CNS is, you can hear, first alcohol affects the forebrain in the cerebral system. It affects the forebrain and assaults the motor coordination and decision making. The person will lose decision making and coordination. First of all, it affects the forebrain, and then alcohol knocks out the midbrain after that. And then if the midbrain is affected, then the person will lose control over the emotions, and there is increased chance of blackout. The person will be unconscious on the roadside. And number 3, finally, the alcohol will affect the brainstem, which is very important. It affects the heart rate, it affects the body temperature, it affects the appetite and consciousness, and it is very dangerous because brainstem, which is medulla, which has the vital centers of respiration, if it is affected, then the respiration will stop and the patient will die. So we know that it is a stage of death which occurs if the alcohol concentration is greater than 500 milligrams per 100 ml. So through all the 7 stages, a distinct alcohol odor is present. So in all the 7 stages, alcohol odor is present because 10% of the alcohol is excreted unchanged through lungs, and then through urine, and then also through sweat. And then we know that ethanol is mydriatic. It dilates the pupil, but towards the terminal stages, it will constrict the pupil. In the stage of stupor, in the stage of coma, pupils may be constricted only to dilate once after death. So medico-legally, the stage of excitement, stage of confusion are most important because it is a stage where the reaction time is more, and most of the offenses where the inhibition is affected and most of the offenses are associated with the drinking are committed during these stages because the person is not inhibited, his actions are not inhibited. Whatever he wants, he will do it. He wants to break, he will break it. So this inhibition is lost in a alcoholic patient. So reaction time is increased in alcoholic patient in this stage of excitement and then stage of confusion. So stage 7 is extremely rare and is pure ethanol injection. Management of how to manage this alcohol intoxication whenever the patient comes to you in a casualty. So first the same routine ABC, we have to see airway, breathing and then circulation to be checked. And then the next one is we can do a stomach wash. Stomach wash can be done with a Rayleigh's tube or a stomach wash tube. And then thiamine is given because in the process of alcohol metabolism, thiamine is used. So you will have a thiamine deficiency which will later affect his well-being. So thiamine is given 100 mg IV, and then most of the time he will normally alcoholics will drink a lot but they will eat less. So because of that he will maybe going into hypoglycemia. So that's why we give dextrose. 50% dextrose is given about 550 to 100 ml IV. And then fluid loss, in order to compensate for fluid loss, we'll give IV fluids, oxygen therapy if the lungs are sluggish, and then nerve stimulants in order to stimulate the CNS. Caffeine can be given. So we know that alcohol is a CNS depressant. So in order to compensate that, we give CNS stimulants, which is best is caffeine. So these are some of the management protocols. Airway should be protected, stomach wash, thiamine 100 mg IV, 50% dextrose, IV fluids, oxygen therapy, and nerve stimulants. What are the PM findings? PM findings are, we know that the smell of the alcohol will be present on the mouth, nostrils, and on opening the body cavities. And then we can know some inflammatory changes, acute inflammatory changes in the stomach. All the internal organs are congested and they are edematous. Blood is usually fluid and dark in nature, and you can see brain is edematous and congested. So these are some of the PM findings that we can see. So most of the organs will be congested, edematous, and we can know the smell of the alcohol from the brain tissue. We can, if the smell of the alcohol is not present from the mouth and nostrils, if you open the skull cap and see, the brain itself will smell like alcohol. So brain is edematous and congested. Chemical analysis of the viscera, definitely we have to take viscera for routine viscera and for finding out whether alcohol is present or not and how much quantity is taken. We have to take brain one smear most of the time. We can take CSF, we can take vitreous from the eye, and then blood should be collected from the peripheral vein. So normally in routine we take only blood, but if the blood is not present, if the blood is drained by any accident, then we can take the rest of the organs like brain, CSF, or vitreous. So all this is about acute alcoholism. Now what about chronic alcoholism? Suppose if a person, an individual consumes large amount of alcohol over a prolonged time, long periods of time, then we call it as chronic alcoholism. So it is characterized by pathological desire for alcohol intake, blackouts during intoxication, and withdrawal symptoms on ceasing alcohol intake. So the person will always be wanting to drink alcohol and alcohol. If he is not drinking, he will develop withdrawal symptoms. He will have tremors, he will have headache, he will have uneasiness. So all these are withdrawal symptoms. So in order to decrease the withdrawal symptoms, he will again go back to drinking. And then whenever the alcohol metabolism is finished, again he will develop withdrawal symptoms, again he will go. So it is like a cycle. So he will be in a depending state. So there is a pathological desire for alcohol intake, there is a blackouts during intoxication, and there is withdrawal symptoms whenever you stop giving alcohol. So consumption should be quantified in terms of units of alcohol. 1 unit of alcohol is equal to 8 to 10 grams of alcohol. That is nothing but 30 ml of alcohol. So 1 unit of alcohol is equal to 8 to 10 grams of alcohol, which is nothing but 30 ml of alcohol. So current opinion suggests that drinking becomes a problem at the level of above 21 units per week for men. That means 21 into 30 ml. You can see about it comes about 600 roughly 600 ml per week. If a men are drinking, then it becomes a problematic. And then for female 14 units. So we can multiply 14 into 3. So it comes about maybe 54, maybe around 500 ml of alcohol per week for women. So it will be about 600 to 700 for men, and it is about 400 to for women. So whatever it is, so 1 minute is equal to 8 to 10 grams of alcohol, and then 30 ml of alcohol, and it will becomes a problem if it is 21 units per week for men and then 14 units per week for women. What are the medical complications of alcoholism? The patient can have GI symptoms like gastritis, periodic diarrheas can be there, increased incidence of oropharyngeal and esophageal cancers. So cancer is one risk factor, though very rarely seen, but there is a risk. Oropharyngeal and esophageal cancer, there can be gastritis. Gastritis is normally very commonly seen. And then we have fatty liver with the portal hypertension changes, cirrhosis, very common. Many people are dying in alcoholism because of the cirrhosis. And then increased incidence of hepatic cancer. This is also one of the reasons. So cirrhosis, fatty liver with portal hypertension and hepatic cancer. And the pancreatitis is also very common, mostly in diabetics. So pancreatitis, acute and chronic pancreatitis. Young people are dying because of this alcoholism leading to pancreatitis. CNS symptoms, polyneuropathy, cerebral degeneration, and strokes can occur. Respiratory symptoms, aspiration pneumonia, and alcohol-induced asthma are one of the other problems the alcoholic patients will face. So almost all symptoms, GIT, liver, CNS, respiratory, and pancreas are affected in chronic alcoholic patients. And then endocrine, we have hypogonadism and feminization in males and infertility in females are the one of the features. So mostly alcoholic because it is a nerve system, a depressant. So we have the features of potency in males and infertility in females. There is hypogonadism, and the patient can have anemia and thrombocytopenia. Myopathy can be there, and then memory disturbances and delusions such as delirium tremors. These neuropsychiatric symptoms are very important. They have been asked many times in examination. Delirium tremors has been asked many times in the examination as a 2 marks and also 4 marks. Wernicke's encephalopathy, Korsakoff psychosis, and alcohol hallucinations. Delirium tremors, Wernicke's encephalopathy, Korsakoff psychosis, and alcoholic hallucination. So alcohol withdrawal syndrome. What is this? Alcohol withdrawal syndrome is nothing but a sudden cessation of alcohol intake in a chronic alcoholic patient can provoke a withdrawal reaction which may manifest in one of the following. So complete abstinence syndrome is one of the entity subheading in alcohol withdrawal syndrome. In this, it occurs within 6 to 8 hours after stopping of alcohol, and the features are the patient will have tremors in hands, legs, agitation, sweating, nausea, headache, and insomnia. So these are the alcohol withdrawal symptoms. If there is complete abstinence occurs within 6 to 8 hours of stopping alcohol, there will be tremors affecting hands and legs, agitation, sweating, nausea, headache, and insomnia. What is alcohol hallucinosis? It occurs within 24 to 36 hours, in which the objects appear distorted in shape, shadows, and seems to move. So this is known as alcohol hallucinations. Objects appear distorted in shapes, and then shadows seems to move. So for this, we give treatment with chlorpromazine 100 mg 8 hourly. Chlorpromazine is given 100 ml 8 hourly. It occurs within onset of 24 to 36 hours, which will be known as alcohol hallucinosis. So alcohol withdrawal syndrome, two types: alcohol abstinence syndrome and then alcohol hallucinosis. And then we have seizures. Seizure, otherwise known as rum fits, which occurs onset about 7 to 48 hours, and they are tonic and clonic moments with or without loss of consciousness. Seizures can occur in alcohol withdrawal syndrome, which we call as rum fits. And then alcoholic ketoacidosis. Onset is about 24 to 72 hours, and the features occur during withdrawal as well as after episodes of heavy drinking. And then what are the features of this alcohol ketoacidosis? The patient can have drowsiness, confusion, tachycardia, and tachypnea. Tachycardia, tachypnea, drowsiness, and confusion. And how do you treat this alcohol ketoacidosis? Give IV fluids with dextrose, give potassium supplements, and then give thiamine 50 to 100 mg. So alcohol ketoacidosis, seizures. Delirium tremors, very important. Asked many times in examination. Onset is about 3 to 5 days. There is a dramatic onset of disorderly mental activity characterized by clouding of consciousness, disorientation, and loss of recent memory. There is loss of recent memory. The patient will have long-term memory, but the patient will lose recent memory. And then there is disorientation, there is clouding of consciousness, delirium tremors. There is visual hallucination, there is severe agitation with restlessness, shouting and tremor, sweating, fever, tachycardia, hypertension, and dilated pupils can be there. Dehydration and electrolyte disturbances are one of the features of delirium tremors. Mostly there is clouding of consciousness, disorientation, and recent memory loss. And there is visual hallucination, there is restlessness, agitation, shouting, tremor, tachycardia, hypertension, dehydration. And then we have dilated pupil. So, and what is the treatment? So, reassure the patient. For agitation, give diazepam 5 to 10 milligrams IV, and thiamine also is given 50 to 100 mg, and correctional fluids and electrolyte balance if any onset. So, delirium tremors occurs onset in 3 to 5 days. It is due to dramatic onset of disordered mental activity characterized by clouding of consciousness, disorientation, and loss of recent memory. Wernicke-Korsakoff syndrome. It is a rare withdrawal reaction and is due to thiamine deficiency. Wernicke-Korsakoff syndrome. And we have Wernicke's encephalopathy because of this. It is an acute form and is characterized by drowsiness, disorientation, amnesia, ataxia, and external ocular paralysis. There is disorientation, drowsiness, amnesia, ataxia, and external ocular paralysis. When recovered from Wernicke's encephalopathy is incomplete, a chronic amnesic syndrome develops called Korsakoff psychosis, characterized by impairment of memory and falsification of memory. So, Wernicke's-Korsakoff syndrome and Korsakoff psychosis are both the same, but if it is severe, Then we call it as cause of psychosis, where there is chronic amnesic syndrome, where there is chronic forgetfulness. There is impairment of memory and there is falsification of memory, which we call it as Korsakoff psychosis. And then if it is Korsakoff syndrome, then there is an acute form where there is amnesia, ataxia, and then ocular palsy, drowsiness, and disorientation. How do you treat? We know that Wernicke's-Korsakoff syndrome is due to thiamine deficiency, B1 deficiency. So give B1 thiamine 50 to 100 mg IV daily as an infusion for 5 to 7 days, and then any fluid replacement, and it can be easily treated. So these are some of the diagrammatic representation of some of the effects of alcohol on the body. There is cognitive impairment, there is esophageal ulcers and varices can be there, liver disease, most important most of the time, pancreatitis, gastritis, stomach ulcer, and then the patient can have memory loss and lack of motor coordination. What is the treatment of chronic alcoholism? De-addiction and rehabilitation. De-addiction and then rehabilitation is the method, and then we have aversion therapy. In order to aversion means to develop a hatred towards alcohol, we give a drug called disulfiram. Disulfiram, which is a disulfide molecule. It interferes with the oxidative metabolism of ethanol at acetaldehyde stage. At acetaldehyde stage, as a result, acetaldehyde accumulates, producing unpleasant symptoms. The patient therefore avoids intake of alcohol as long as he is on disulfiram. So here we know that the metabolism of ethanol, from ethanol it is converted into acetaldehyde, from acetaldehyde it is converted into acetate. So from ethanol to acetaldehyde we have alcohol dehydrogenase, and then from acetaldehyde to acetate we have aldehyde dehydrogenase. What this disulfiram will do is it will prevent this aldehyde dehydrogenase, thereby preventing the conversion of acetaldehyde to acetate. So thereby the acetaldehyde will accumulate in the blood and it will cause ill effects on the body. It will cause vomiting sensation, it will cause some nausea, it will cause some irritation. Thereby the patient will avoid drinking alcohol. So this is a disulfiram, a disulfide molecule drug, and the dosage we give is 250 milligrams orally 12 hours before consuming alcohol. 250 milligrams orally before consuming alcohol. This is de-addiction drug. De-addiction drug is disulfiram. So what is the forensic significance, medical legal importance is, we know that all the brawls and assaults, suicides, homicides are associated with alcohol. We have infamous conduct also in this infamous conduct where the doctors should not have the alcohol consumption in public, and then all over India except Gujarat, mere consumption of alcohol and drunken behavior among themselves is not an offense. So in Gujarat, even it is a dry state, drinking alcohol is also prohibited. Infamous conduct, we know that 6 A's. In 6 A's we have 1 A is alcohol, and then we have adultery, advertisement. All these A's are there in infamous conduct. So in that, one of the A is alcohol consumption. So the doctor should not take alcohol and do a surgery. If the doctor should not take alcohol and do in OP and sit and see the patients, because his treatment will be affected. So infamous conduct, and also alcohol is involved in all kinds of crimes. Methyl alcohol, the alcohol we will look into in the next class. Thank you for joining. Thank you very much. You can leave now.